So COVID-19 is causing lower back pain. Did you know that? COVID-19. We've been getting hundreds, I'm not kidding, hundreds of patients who are coming in here and saying they have back pain, and I'm realizing it's actually COVID-19. So I bet you want to know, how does a virus cause low back pain? I thought it was like a respiratory thing, you know, flu-like symptoms, all that stuff. Listen, I'm not the expert on COVID-19, but there's one thing I am sure about, and I am the expert on this. It is absolutely causing low back pain, and you want to know why? Here's why. People are sitting at home working. They're sitting in chairs that are not ergonomically correct because of COVID and the quarantine. They can't go to work. They have to work at the dining room table or something else, just sitting the wrong way. So let me tell you how that happens. See, the spine, this is Charlie. Don't worry, Charlie is not a former patient. This is a plastic model of human spine, and he's got the proper curves. Curves are good, remember that. And so the spine has bone, disc, and these openings in the back where you have nerves that come out. Your brain sits up here and your spinal cord goes right through there. So when we're standing, this is the curve that your spine should have. By the way, if Charlie had a nose, it'd be pointing toward Devin, okay? So this is his back. When we sit, we lose that curve. Look at this. It goes like this. Now what happened to Charlie's head? Went forward, right? You guys have seen people who sit and their head comes forward like that. Would you demonstrate?
Of course.
Have a seat and give me a really bad posture. So awful, right? That Charlie and Devin look very similar right now. This curve is missing, and it's pulling. See, when the curve is lost, you can sit up. When the curve is lost, it pulls on the spinal cord, and the sciatic nerves come out and go down the leg. That's why a lot of people are saying they have pain that shoots down the leg, down the thigh, even down to the foot. Sometimes they're having numbness in their toes, and they're sitting at their computer, and that pain is there, and they can't move. So here's the thing. How we sit should try to maintain that curve. So I want you to sit on the front forward edge of the chair, and I want you to arch the lower back in an exaggerated fashion. Take a look. You can see with this arch being here, everything above automatically straightens out. Like if I maintain this, I'm just going to put my fist here and push in. Go ahead and lean against me a little bit, and then try to slouch. It's not possible. You can't do it. Try it at home. It's not possible. So here's the thing. One thing that gets in the way of you being able to sit upright properly like this is tight hamstrings. So notice Devin is sitting and his hamstrings are short because his knee is bent. So if your knee is bent, anytime you hold a muscle in a shortened state for a long period of time, it learns to stay short. And so watch this. If Devin, stay on the edge right there, arch the low, actually before you arch your back. So slouch just a little bit and straighten that leg for me. Good. You can see you can straighten it all the way, put it down, do the other one. Perfect, right? Now watch this. When we put an arch in there, push this forward. Good. Posture is better right now, but now try to bring that leg up without losing that arch.
Much less.
Feels a lot tighter. And you try this at home, because if you can't get it up as high as Devin did, like that's fairly normal nowadays. Now if he was really flexible, he'd be able to straighten it all the way. But if your knee doesn't come up, your foot doesn't come up as high as his did, you have extremely tight hamstrings. And that's going to pull your spine down and do what that did right there. Your hamstrings attach up here. It's going to pull the pelvis in like this. And even when you're standing, you're not going to have the proper curve. See, when the curve is lost, forces go into the discs and cause the bulging and the herniation. Typically more bulging than herniation, because herniation is trauma related. But it's going to make you susceptible to a herniation. If you bend the wrong way and pick up something heavy, you'll blow that disc and it'll get herniated. So here's the thing. What you also have to know is if you sit up real tall with a big arch and you lift that leg and you get a pain in the low back, even if it's just a little bit of pain, that means you have a bulge or a serious misalignment that's pushing on the spinal cord and putting tension on that spinal cord. So do this exercise. If you lift the leg, your hamstring feels a little tight, not too tight, a little tight, and you don't have pain in your low back, you got to do this exercise at home every day. So here's the exercise. It's kind of like what we did. Sit super tall, push that out, straighten this leg all as high as you can. You count to 2. 1, 2. Go down a little, come right back up. 3, 4. Go down, come back up, count to 20, right? So basically it's a 2-second hold, 10 repetitions. Right? So that's why I said count all the way up to 20. So you could do 1 Mississippi, 2 Mississippi, down up, 3 Mississippi, 4 Mississippi, down up. 2-second hold at the top, 10 repetitions on each leg, and you should do that at least once a day, especially if COVID-19 is making you sit at a chair that's not comfortable for you. Let's protect your backs. Let's overcome this virus. Let's stay healthy. If you are having problems though, call someone like a chiropractor. If you live nearby us, you can certainly come see us. Mid-Atlantic Chiropractic Center, midatlanticclinic.com is our website. Otherwise, find a chiropractor near you. Tell them what's going on. Let's get this thing corrected, because once it gets bad and it starts going down the leg and you have numbness in your foot, you're not going to be able to walk. And then surgery might be your only option. Let's not do that. Take care. I'm Dr. Amir Rashidian. We'll talk to you later.